What is a herniated or slip disc? Hey everybody, this is Mike Erlob with another episode of Power Your Life. It is so good to be here with you guys again. I'm so excited. We're going to be talking about some really cool stuff, some things that's really applicable that you can just put right into action and implement right away. And what I want to do is it's an area that's near and dear to my heart. Is your spinal discs. Okay, so this is really often a very misunderstood area, and what I would hope to do today is really bring some clarity to you. Bring some clarity as to what's going on with these things, and get rid of some of these myths and false beliefs that are out there, and just really get you on the right path so you know either how you can avoid these becoming a problem, or if you have one, what do you do about it? But first, what I really would like to do before we go into those details is I'd really like to tell you about the issue that my wife, Shauna, has had with her back. And, back in her high school days, she was a very avid softball player. And then when she finished high school, she continued playing softball for some recreational leagues. She was very, very competitive, did a lot of twisting and bending. She could knock the ball out of the park. Her nickname was Ruth back in high school for Babe Ruth, because she would hit the ball so far. But she had back pain even from her high school days that had been kind of on and off for several years. And this was quite a few years ago, but one day she just woke up, and she just had this really intense pain, really intense in the middle of her back, and it was radiating down her leg into her big toe. And then the thing that she noticed, and it just what really scared her, was she couldn't stand up straight. And so she was bent over. She was, if I remember right, she was just a little bit over 30 years old at that time. So for most of us, it was like, man, that is just too young to be having back problems. And she was supposed to start a new job. And she couldn't go to work. She couldn't stand up straight. She was in this very intense pain. And if you've never had that kind of pain before, or been around somebody in that kind of pain, it's like they can't even get out of it. Any position she tried to get herself in, she could not get rid of that pain. She couldn't walk without a walker. For several days, she had to use a walker. And we immediately got her into the to the doctor. They ordered X-rays. They did an MRI, and when I looked at her MRI with her doctor, I couldn't believe what I was looking at, because her disc space was completely gone in multiple levels, and then she had a couple of very large bulges or herniations that was pinching a nerve. And they looked at it, and they told her that she was a non-surgical case, and so she was really scared. She's in this pain. She can't stand up straight. She's only about 30 years old, and she doesn't know what's going to happen. What's she going to be able to do? Is she going to be able to work? Is she ever going to be able to stand up straight? And we went through several different doctors. She did indeed have some injections and some things that helped with that initial pain. And then we realized that her muscles were in such an intense spasm that we really worked really hard at getting that to settle down. And although the injections, they took away some of that leg pain, she still had that really intense central back pain, pain into the buttock. If you've ever experienced that pain, literally it's a pain in the butt, and it is just brutal. You can't get out of it. And we realized that, hey, her muscular system was extremely imbalanced. So we worked really hard at getting these what we call hypertonic muscles, these muscles that are all contracted up, they're into a spasm, and we worked really hard at just getting those things to shut off. We got her on the right direction with alleviating the weaknesses in her body. And although, she still at times, if she overdoes it, she'll have problems, but we know what to do to fix it. and she, thank God, hasn't had to have any other further injections, no other further intervention other than occasionally, she needs to get on the right path if she stops with her exercise program. So she is living proof that you can fix these things, that you don't have to go the route of surgery, but sometimes you have to. But what I wanted to highlight in this was that these discs can really, really affect your life. And they can really cause a lot of problems for you when things start going bad. So let's dive right in, okay? Let's dive right in, and let's talk about what these things are. What are these discs that I'm talking about, okay? So what we're doing is we're talking about disc herniations. We're talking about what we call slipped disc. But you guys, got to understand that these discs do not slip out of place, okay? So they don't actually come out. So a slipped disc is really a misleading term. And I only put that in there because it is such a common term, but they don't actually slip. They bulge or they herniate. So what I'm going to do is I'm going to give you a really quick anatomy lesson here. And you see, so your back is comprised of individual vertebrae. And so each of these individual bones make a segment. And the lower back, which is called the lumbar, has five vertebrae, 5 individual. And then in between these, we have these little cushions. And these cushions are your discs, okay? So these discs are held in place by thick ligaments. But the disc, I want you to think of it kind of like a jelly donut, or another way to think of it is kind of like an Oreo cookie, okay? So your spine literally is like a stack of cans, one on top of the other. And in between those cans is a little jelly donut or Oreo cookie, okay? Now, the cans of the vertebrae, the cookie or the disc or the jelly donut are your discs. Now, what happens is, you see, these discs are made out of a material that's called fibrocartilage. It's like a really spongy type of cartilage, and they're designed to help maintain the space. They're designed to absorb shock, okay? And the outer edge of the disc makes a ring that holds in the center. And that's why I said like an Oreo cookie, like a soft center, right? Or think of it like a jelly donut. So it's jelly in the middle, and then you've got the donut on the outside. Now, what happens is with time, okay, because of stress and wear and tear, the edges of the cookie or the edges of the donut, they start to wear out. So in this case, the edges of the disc start to weaken. And the material, because of compression, because gravity is always trying to squash us, causes the inside material, which is like a jelly, to start to push out because of the stress. And what happens is it will start to bulge. And that's what you're seeing right here, is you're seeing the disc, which is healthy above and below, but right here, this would be a disc herniation, okay? This would be a bulge, and it starts out where it's just a little bit, and then it gets bigger and bigger, kind of like a balloon, it really balloons out, and then can actually herniate to the point to where it pinches the nerve. It pinches the spinal nerve. Now, when it does that, it is extremely painful. So the act of the bulging or the herniation, really, you don't even know what's happening. This can happen over a series of years. But when it starts to pinch the nerve, that's when things go south. So this disc doesn't slip out of place, it bulges, okay? Now, you can't just push the disc back into place. It doesn't work like that. You see, fixing the disc requires that you have to reduce the compressive forces that are causing it to herniate. So if you think about, and things are being like squished down really tight, we've got to figure out, well, how do we decompress that? Okay, now there's a lot of ways you can do that. Traction, and there's different exercises. And the disc can heal if it's given the opportunity. And that's what happened with my wife Shauna, is we were able to actually decompress her spine by getting those muscles to balance out. And her disc was actually able to heal because now her pain doesn't go down her leg. There's no more pinching of the nerve. And although we can't reverse the degeneration that's occurred from her years of softball, we can keep it from being a problem for her. So the real question is not, when the disc herniates, what do I do? The real question is, why does it herniate in the first place? And you see, that lies the $1,000,000 question. You know, it's kind of like which came first, the chicken or the egg, right? So your discs just didn't decide one day to weaken and for that internuclear material to start pushing out the side. You see, this was a process that had taken years for this to happen to people. There are forces in your back that are at work that are extremely destructive to your spine. Now, trauma, genetics, compression, these all play a role in the wearing out of the discs, okay? But the real cause of a herniated disc is not those things, it's what causes those things. And we're going to talk about is if you've had trauma to your spine, you know, that it's unfortunate, we can't go back and fix that. Genetics, you're born with what you're born, okay? So that, again, we can't really change that either. However, compression, the compressive forces to the spine, we can change that. That is a factor that we can manipulate and we can reduce, which then takes the pain away. Okay, so the real cause of this herniated disc and the compression are the imbalances in your body that have been created by too much sitting, too many repetitive movements, doing the same job tasks over and over again, and, you know, past injuries and past trauma, because your body heals, but a lot of times you heal with compensations that end up using too much of the wrong muscle group, not enough of the right muscle group, and hence you get increased compression in the spine. And so these imbalances result in your muscles becoming really, really tight, okay? And don't think of them just like a tight muscle, because when a muscle's tight, you can stretch it out. You know, when your hamstrings are tight, you can stretch those out. What I'm talking about is a muscle that is too active, okay? And we call that, so the tone of the muscle means how much activity is in that muscle. We call these hypertonic muscles, all right? So these muscles become hypertonic, and then it becomes weak. And then the back system, everything around here, it is just completely thrown out of whack. And the result is, again, compression on the discs. So all of this squeezing down. And this results in increased pain, irritation, inflammation, as that nerve right here starts to get pinched from that herniated disc. So now you can go in here and you can just deal with the disc, right? But you still have a problem because all of these other issues that led up to this, they're still present. And that problem is going to return. So there are the main areas for imbalances with disc-related problems are going to be hypertonic or tight hip flexors. So these are the muscles that come off of here, come down and attach to your front of your femur. Okay, we call them hip flexors. Very weak glutes. So on the backside, your gluteal muscles. Also tight hips and weak lower abdominals. And we break those abdominals up to an upper half and a lower half. We're talking about the lower half that becomes weak. All of these areas, guys, these things, they're designed to complement each other. They're designed to work together. All right? So that's what I want you to understand. If you take anything home from our video today is, listen, your system, the human body, it was designed in the image of God. It is an amazing machine, but it is designed to work as a machine. And that means that all of your systems and these muscles, the muscle system, they're designed to complement each other and work together. So when one area loses movement or flexibility, such as, you have to use your imagination because I just have the spine and the pelvis here, but your femurs are coming off here. This is your hip joint. So if you lose flexibility or movement in your hips, there's going to be increased compression to the spine. And this happens because I want you to think of the spine like a big slinky. Okay, so you guys have done those, you know, the old slinky where it goes down the steps and each of the coils has to bend with the next one. All right, that's what happens with your spine. All of these little segments work together like a slinky. All right, and the human body is strictly a bunch of lever arms that are put together, and they're like a bunch of segments that are linked. So your spine's a slinky. However, the movement, say, of bending over and touching your toes, or let's think about like the movement of putting your socks and shoes on or tying your shoes, that movement needs to occur at your hips, okay? So if your hips don't move because they've gotten too stiff, because your hip flexors are too hypertonic, and you can't bend over very well, or you can't sit down and put one foot on top of the other knee, you still have to put your socks and shoes on, you still have to bend over. So now what happens is when you bend forward, instead of the movement occurring from the hips, all that extra movement occurs at the slinky, at the spine, and it will wear it out. And so then it pulls on the spine, it compresses it. The same thing happens if your glutes, if your butt muscle's too weak. You see, that's designed to counteract your psoas or your hip flexor. And if these are too weak and they're shut down, they can't balance out the hip flexors. So now what happens is your hip flexors become very hypertonic, your glute muscles become very weak. It actually causes your pelvis to tip forward. We call that an anterior pelvic tilt. But when it tips forward, it compresses that spine because of its pull on it. And you can even see that if I stand here with a normal, like more of a neutral pelvis, and then I tip it forward, it jams everything together back there. And again, compresses the spine, and the result are damaged discs because you walk around like that all day. So one other analogy, and I love analogies, especially playground analogies, because they're just so much fun. But I want you to think of your back like a seesaw, okay? And you want the seesaw to be balanced out perfectly. It has to be even, okay? So, you know, you've got muscles in the front, muscles in the back, you've got hip joints, and all of those things affect your spine, all right? You got to get it all balanced out. Everything has to work together. Now, you can decompress this disc with traction by laying somebody down and stretching them out. But the minute you take the traction off, it's going to go right back to compression. You can even go in and you can even surgically trim that out. Okay, we call that a microdiscectomy. You can go in and you can remove pieces of bone. We call that a laminectomy. I mean, we can do these things, and I can't, a surgeon can, but you could even go in, remove the disc, and fuse the segment. All right? But the reason you're still having problems is because the imbalances are still present. The things that caused the disc to herniate in the first place haven't been fixed. And until you do that, until you address that, that is what we call the root cause. All you're doing is dealing with what's generating the pain. You're not dealing with what's generating the cause. And you see, I want to get a little bit on my soapbox here, because that right now is my biggest issue with the way our medical system is treating this problem. You see, you go in and they order an MRI, and they did this with my wife. They order the MRI and they look at the spine and they say, aha, you got a bad disc. That's your problem. Let's treat that. Hey, let's throw a bunch of anti-inflammatories at you. Let's load you up with a muscle relaxant. And oh, by the way, we got this really cool thing called oxycodone or Oxycontin or hydrocodone or Vicodin, and it'll make you feel better. None of that fixes the problem. None of that addresses the root cause. And even if they go in and we start doing injections in this area, it doesn't fix the problem. You know, it just puts a Band-Aid on it and it kicks the can down the road. You see, nobody is looking at why are these imbalances present. What can we do to fix them? Our medical system just wants to go to what they say is the disc, inject it, remove it, and then they're going to tell you that, hey, you're better, your back is all fixed. And although you immediately remove that immediate pain at first, yes, you do feel good for 6 months or a year. But guess what happens? The problem that caused it in the first place is not fixed. And you have discs above and below, and what happens to them? They start to go bad too. So you are not fixed until you deal with these imbalances. That's extremely important. And until you do that, you will continue to have problems. So at this point, what I'd like to do is I'd like to leave you with a quote by Catherine Pulsifer. I want you to give you something to think about. And she's a author, and the quote that I really like of hers, it says, "Too much of one thing can end up creating stress. This is something that no one needs in their life, but living a life in balance can provide harmony and peace." So, remember, okay? If you take anything home from this, it's about balance. And not just balance in your body, but balance in your life too. You know, we're all striving for that. You know, if you would, if you'd like to know more, I do have a new ebook out, and it's called the five best kept secrets to fast back pain relief. And if you would like a copy of that, it's free, no strings attached. We'll send it out to you. All you got to do, just send us a Facebook message, just say, hey, I want the back report, or better yet, just email me. I check my email all the time. I will get back to you, okay? I'm not like Tony Robbins that, you know, has all of these people coming at him. It's just me. So I still check all my own email. I respond to my own messages, but just email me at mike@flex. There's a little hyphen, flex-pt.com. That's Mike at flex-pt.com. We'll post this in the comments. I'll let you guys think on that quote for a little while. But until next time, power your life and keep moving forward.